Welcome back. We're going to go over some examples of what you could have had in your small group as answers to those PICO questions. So the bath basin case study, when you looked over that, it could have been, the population could have been post-op patients. You could have just had patients. It's okay. These are just examples. Intervention, dispose of a bath basin that's used for emesis. So once someone has used it for emesis, you could have thrown it away. You could have had other interventions such as different colors for different reasons, depending on what your group talked about. Comparison of using the same bath basin for every patient for every time someone was exposed to emesis. And the outcome, I would hope you came to the outcome of the decreased infection for post-op patients or for your patient population. So that's one example of what could have been. For blood culture contaminations, for that case study, population are patients in the acute care setting, or it could have been patients that got blood cultures. Intervention is using a sterile process compared to using a clean process or not sterile process. And the outcome would have been decreased blood culture contamination rates. Healthy food options case study. So your population could have been, as one option, night shift nurses. It could have been night shift staff. It doesn't have to necessarily be nurses. Intervention, having access to healthy food options during the night shift compared to not having access to healthy food options in the night shift. And your outcome is that night shift nurses will have more energy to work on their shift. You could have had other alternative outcomes, depending on what you talked about in your small group. And the last one, night shift tiredness. So this one, population, one option is night shift nurses or staff. Intervention, a 20-minute power nap offered every night shift worked, or it could have been a 20-minute power nap on the third shift. I mean, depending on what your group talked about. Compared to not taking a nap, and the outcome would be nurses report more energy and that they're more productive. That could have been one of your options. Again, there's more than one type of option that could have been discussed. Each one of those case studies were actually a nurse residency project that were done. Let's talk about what is evidence-based practice. So that's always a question I get. Evidence-based practice, it is clinical expertise. It is what we find in the research, but it is also patient values. So we can do research on things, and if a patient's not going to do it, it's really not going to be something that we want to implement in our patient care, which would be all these together. That's our evidence-based practice, what we're practicing at the bedside. I also get this question: what's the difference between research and evidence-based practice? So research, you're collecting a bunch of information. Where evidence-based practice, you're actually putting it to practice. So yes, they all come up with research, but this is what's the best type of care to give to our patients? So application, barriers to evidence-based practice. There's lots of barriers out there. These are the most common barriers. Lack of knowledge about evidence-based practice. So you just didn't know that there was a better way to do something. Individuals don't know how to complete a literature review or find literature. So that's one of the things we will talk about here shortly, but you'd be surprised how many people don't really know how to find literature on that topic. Research articles are challenging to read and review. I agree, they are challenging sometimes to read and review. Time to research and implement an evidence-based practice project. Time is the challenge. And not knowing how to navigate the evidence-based practice process. We can talk about that as well. Hopefully we can give you tips to help get through some of these barriers for your evidence-based project for your nurse residency. Here's the steps that we recommend. So you're gonna start off by asking your question, gather your team. Your team's gonna be part of your nurse residency group. You have to come up with a PICO question, create a plan or a timeline. When will you have this completed? I like to start out with the end, when's it due, and then work backwards. That's one way to do it. Brainstorm all the different terms. So if you were talking about a cell phone, you can come up with all kinds of different terms. An iPhone, Samsung, a mobile phone, all kinds of different things that you could say that for a phone. Actually, we come up with a list of like 20 some words that you could use when you're searching the literature. So knowing different terms on whatever the topic is that you're researching is helpful for finding articles. And then search through the evidence. You might have to read lots of articles before you find the articles that work best for your project. once you get your articles, read and you're going to evaluate them, evaluate the evidence. Does the evidence show that what we're doing is already the best practice, or does it show a new way to do it? Summarize your evidence. We have a special form for you that you can summarize your information, and you're going to determine recommendations. What do you recommend for the system? And then find ways to implement your project. Okay, are you ready? We're gonna get started. So ask the questions. So when you're going around and you're saying, why do we do what we do? When you're asking your coworkers, you might also ask your manager, you might ask your librarian, why do we do what we do? Look in your research, look in the literature, but ask the people at the bedside. Gather your team. So in your groups, some groups have a lot of people in the nurse residency group. We're gonna have around 4 people per group. Each person has to present in the final presentation, and so you want it to be around 4 or 5, but not 20 people in the group when you only have a few slides that you're gonna present, a few articles that you're gonna present. So you're gonna figure out who's on your team and what your topics are, so gather your team, and then you're going to, in your team, create that PICO question we talked about. So you wanna break down every single part of your PICO question, which we just went over earlier. And then you want to start planning that timeline that we talked about. Find out when is it due and start backing up and figuring out who's doing what. One way you can do it is do it on a Google Docs. That's what some of the groups do, and that way everybody has access to the final project, and then you can see how other people have, how much they've done, and you don't have to slice and dice and put things together. It's already done for you. Remember that brainstorming process? So if you're trying to brainstorm, you might come up with different terms in your group of terms other people hadn't thought of, but you want to think about all these different words that might be used to be able to find that literature that you need to find. And then you're going to search the evidence. Caryl, you want to help us with that?
Yeah, absolutely. So here's the key thing about searching the evidence. Here's all kinds of things that you can use to search the evidence. I will tell you, one of your friends is going to be Google. And I know that's weird to say because everybody says don't use Google to look anything up, but actually Google is a very good thing to use. And it could be your number one step. I think the key thing is that you're going to use all of these things that are on the slide. Absolutely, you're going to use the EBSCO, Ovid, PubMed, UpToDate, Lexicon, and your librarian. So how do you fit that all together? And it really just depends on how you work and what your other team members and how they work as well. So one of the things that I've done, and you have this handout, is I've created a search tip sheet. It's two pages. And I do it step by step. You don't have to do these steps, but I think they're pretty good since I made it up, right? I think they're pretty darn good. So step 1, there are 2 big databases that we have, AHRQ and Cochrane Library. If you have a PICO question, I would start there first, and your PICO question, you can just copy paste it into the Cochrane Library and also AHRQ. What these 2 databases do is find you the synthesis review, which is your high level gold standard research that you want to find on your PICO question if it's out there. If it is out there, it's going to be in one of these 2 databases. So that's always a good thing to do. If you can find that, then you're set for life. So that's why I say go ahead and start there. And then you can go down if you don't find anything and do the Google Scholar search. So when you're in Google, you want to type in Scholar and it'll go to Google Scholar. You actually click on that and then you can go through all of these things that I have here. There's a lot about using specific words when you tie your words together, like or, and, or not. You can read through all of this. Nothing is there, but I think you'll probably find something there. I do have examples here for you. Then you can go to step 3 and search PubMed. And then I do have a second page on this and about the CINAHL, which is the nursing database as well. And then help from our St. Luke's Health System librarian. One of the things that I have found when I use the librarian, she's absolutely wonderful.
Yes, she is.
And she really does well. If you find this one article that totally answers your PICO question, you send her that source and say, I want more like this. And then she can give you the best search that she can give. Now, you can also just type in your PICO question to her, but she's going to send you a whole lot of stuff, which is fine, not a problem, but then you kind of have to dig through and find what the 1 or 2 or 3 articles that are there that are going to specifically relate to your topic. Nothing wrong with that. So you can do that at the beginning, but if you really want to dig down and get the right thing, go through all the other steps first and then send her that 1, or maybe you found 2, 1 or 2 resources that she can look at and say, okay, I need to specifically stick to what this article is about. Down here at the bottom, these are the links to the EBSCO databases and the OVID that is mentioned before. This is where you're going to find PubMed and CINAHL. You can use these outside of St. Luke's, so if you're at home, you can click on this and it'll go right to it, so you can do your own searches here, which is pretty awesome. Again, contact the library, she's pretty great, they're wonderful, really, really easy people to work with as well. And
this is an example of,
that is example.
they'll send you a list, and it might be 25, 30 different articles, and you'll say, I want Article 4, and I want Article 6 off this list. I just respond to that list on the email, and they'll send you the full length of each of one of those articles, and you can read it more. But you kind of get an idea of some things that she found. Maybe it wasn't spot on, so you need to rethink your words that you want to use to search for, but this gives you an idea, and they usually do it pretty quick, too.
Yeah, she gets back to you right away. I mean, like within 24 hours.
Right away.
She's pretty great. Yes. Reading and evaluating the evidence. Oh my goodness, we talked about this earlier. This is really probably the more difficult area, and we're here to help you to do that, right? So I think one of the things that is important to realize is that any evidence that you're going to read can be research, and it doesn't have to be research. And it's okay to read both. And you're going to appraise both of those kind of pieces of evidence. So again, we use the Johns Hopkins evidence-based practice model, and we use the resources related to that model. In that model, they really categorize research as level 1 through 5. Level 1, 2, and 3 are research related, and level 4 and 5 are not resource related, but they are important pieces of evidence for you to read and for you to appraise. So we're going to go through that a little bit more. The key thing about appraising any kind of article is not only deciding whether it's a level 1, 2, and 3, but also deciding on the quality of that article. And so for your quantitative research, which is all about numbers and quantitative kind of data, you will be saying, well, maybe it's high quality, or maybe it's just good, or maybe it's low quality. And you can use, again, all of the resources from Johns Hopkins evidence-based practice model to help you determine what the quality is going to be for each one of those articles. Again, qualitative research is around asking people questions in focus groups, asking individuals questions in interviews, observing people in their own setting, and it's really getting to the phenomena of whatever you want to study is really what qualitative research is. It's not about numbers, and it's not about necessarily data. Now, it is about data in that data are now words and themes that people come up with when they do qualitative research. So again, if you get a qualitative research article, you will be using the appraisal methods that Johns Hopkins gives you, and it's a very step-by-step process that you'll be answering questions related to qualitative research, and it will help you with the appraisal. So with qualitative, you will determine whether it's a level 1, 2, or 3. It's level 2 or 3, by the way. And then you will also look at, well, how good of a research article was this, given that it was a qualitative research. And you'll determine A, B, high or good quality, or C, low quality. Again, all of these resources you have at your fingertips. So I'm not going to go through details necessarily at this point. Now, I will go through details around the appraisal document that you use for levels 1 through 3. And this is also called Appendix E. Again, you have this in front of you. And the first page, you want to start out by entering the author, the title of the article, a little bit about the population and size and setting of that research article. Again, this is research, so you're going to have to identify it as research so you can pick this appraisal piece out. So you want to do a very short synopsis of how this research article answers your PICO question. And that's all on the first page.
Yeah, and this up here, the number, you could put in which number of article you're reviewing. So if you have 5 articles, you can actually number them so that you can put it in order of how well you think the articles support your PICO.
Yeah, absolutely. Okay, after that, then you just work down the page. You say, okay, in this study, was it quantitative? There was collection of data, there was analysis, etc. And how they go through and talk about quantitative will help you after you've read that article. So if you check mark that, then you go immediately to this first section. And this first section is going to ask you, is this a report of a single research study? A single study. So, is it just one population that an author or a researcher studied and they had one specific question that they're actually asking as part of their research? So, there are other types of studies or evidence out there which puts a bunch of research studies together, like 10 to 20 to 30 of them. And they put them together to analyze the question that they're trying to answer. And all of these research studies answer that question. That is called a synthesis review. And generally, you will know it's a synthesis review because they almost always have it in the title. So if it is a synthesis review, then you're going to pick another place other than here, because this is asking you if it's a single research study. You're going to go to the multiple research study page. Again, this Appendix E will guide you all the way through that and ask you the right questions to get you to the right place to do your appraisal. So if you use this, again, they're going to ask you questions at the top. You just answer them. And it will give you whether this is a level 1, 2, or 3. Right here at the top, it'll tell you which level it is. And you want to very well know what that level is. If I back up for a second, you want to note that right here, evidence level and quality rating. So you back up and go ahead and put in the evidence level after you figure out what it is. And then you're going to appraise the quality of this research study by answering all these questions that are right here. These yes/no questions across the pages. Some of them you'll see right here in the middle, there's some NAs. And it's okay to put NAs because some of these things are not randomized control trials. And so when you don't have a randomized control trial, you don't have control, et cetera, et cetera. So it's all NA over here. I think this will help guide you along your pathway. I will tell you that I have another video off to the side here and that goes through 3 different research articles, goes through each one of these appendices so you can follow along as an example. I think that will help you when you're trying to read your own research as you go through. Okay, this is one of the research articles that I take. This is a quantitative research article. I go through the appraisal on this other video, and I kind of tell you also where to focus your attention. Like, skip over all those stats except for one little area. So there's a little clue for you to watch the video and see what that one little area is. But it's things like that that will help you get through these articles in a way that you're not, pulling your hair out or, screaming a little bit because it's a little difficult to read, right? So please go and watch that video. I think you'll find it helpful. Okay. Again, the qualitative appraisal, I think we already went through that. The high quality, good quality, or low quality. The second one, as you remember I just mentioned, this is section B. Is this a summary of multiple sources of research evidence? Remember I talked about that synthesis review, with or without a meta-analysis, is that kind of evidence that gathers lots of different resources, research, etc., puts it all together and makes some recommendations off of it. You do have a research definitions cheat sheet as well, so please look up all these terms that I'm talking about. I'm explaining them right now, but you might forget. So, oh yeah, what's that synthesis review? Go back to that research term. Meta-analysis is also on that research term definition sheet. So again, they're going to ask you some questions about this multiple sources of research evidence, which is usually a synthesis review or a meta-analysis. And then you're going to go through and do yes, no's, yes, no's, yes, no's. And it's going to, after you do this a couple times, it's going to be easier. I don't want to say it's easy right off the bat because you have to learn it, right? So you learn it and then you're going to say, oh, this is a piece of cake. So one of the things I did do as well on that video is that I'm going to go through a synthesis review and tell you how to look at synthesis reviews and really pick out your yes, no's. So again, go to that one. Now, this is the qualitative appraisal. When you get a qualitative research study, it's going to ask you, is this a single research study? The answer is yes. And qualitative is very different. So again, these yes, no's are going to help you determine the quality of this article. And again, I go through an example of that, and this is the example that I use. You do have this with you as well, but again, watch the video. I go through example and explain a little bit more about qualitative research as I go through and look at this and tell you where to look. Like obviously right here I have it yellowed, and that's a pretty good area to look at. Just go to the yellow part, right?
That's right.
Yeah. So again, this qualitative appraisal, you're gonna, after you read it, do your yes, no's, you're gonna decide, is this high or good quality? And again, it does a pretty good explanation of this. These little bullet points, I will go through on the video, excuse me, and talk to you about, what you need to look for in that qualitative research to decide whether they do have transparency, whether they did go through due diligence, et cetera, et cetera. Or do you think that there's a lack of clarity and it's a low quality? I will tell you it's kind of hard to find low quality research studies because quite honestly, they just don't get published. So that's an FYI. I think I already went through that part. So we can go through and talk about levels 4 and 5. Levels 4 and 5 are generally pieces of evidence related to reviews of literature, to guidelines that you might find, guidelines from associations, patient preferences is another piece of, Dana mentioned that before. We got to take into consideration patient preferences when we're talking about the evidence and how we're going to change practice. We can't change practice unless, honestly, that the patients are on board too with that practice. So this is the Appendix F, and this is what you would use to appraise levels 4 and 5. And it will talk to you specifically about, is this evidence a clinical practice guideline, a literature review, expert opinion, case report, organizational experience, which is QI data that you could also get from your unit, quality improvement, a community standard clinical experience. Here's where patient preference comes in. So when it tells you exactly where to go what section to go to in the Appendix F in order to do this appraisal of the evidence. So if you're putting it all together, looking at this, you're going to look at the number of articles that you have pulled to review appraisals, and it can be a mix of levels 1, level 5, level 3, you name it. It can be all over the board, and that's fine. And again, as Dana talked about earlier, you're going to number each one of your appraisals to kind of match what you're thinking is your highest level maybe of evidence and quality. Then you're going to talk about the strength of each one of those articles, do the short sentence of your findings of these articles, and then you're going to use Appendix H in the Johns Hopkins tools to put it all together. And this is the synthesis and recommendations of your evidence. Again, you're going to have level 1, 2, 3, 4, and 5 over here. You're going to enter how many sources you had under each one of those. You're going to enter the overall quality. So say you had 2 level 1s, 2 quantitative research studies that were randomized controlled trials. You would put in here, that there's 2 of them and both of them were really strong. And you could just type in strong. And then you're going to enter a text in here, short sentences about how does this support your PICO question and what were the findings. And so you would do that for each one of the evidence pieces that you find. That's on the first page. The second page has everything to do with you now pulling all of that information together and saying, where does the evidence show consistency? Where does the evidence show not so consistent or inconsistency? And then based on what you're saying is, what are your recommendations? What is it that you want to do? What are next steps? And I love this bottom part because sometimes I almost feel like you need to do this before you do your recommendations. So, is there strong, compelling evidence? Yeah. So what do you need to do? You need to move forward and do a change project on your unit and change things, right? So it really takes you down. If there's little or no evidence, so you're unable to establish any kind of best practice, then you're not going to change anything. And that's okay. There's nothing wrong with that. If there's no evidence out there, then there's nothing to change. But it's your opportunity to do research. And that's when you contact me and help you do the research project, which would be awesome.
And that can happen.
Yes, it can. Absolutely. It happens every single day. I just had a nurse email me this weekend saying, hey, I'm interested in doing a research project. I'm so excited. I get all jazzed up when people are interested in doing research, obviously, right?
And then with your presentation, I'll take that, thanks.
Sure.
Part of your presentation, when you get done, given all the evidence that you have reviewed, you're going to say what you recommend. Again, you could recommend a change of practice on your floor, a change of practice for the entire system, or you could recommend what we're doing is shown in the literature to be the best practice. So we want to see what you found. So once you have that all together, you're going to present this for your nurse residency graduation. Again, we're going to do it on YouTube, we're going to videotape it, and hopefully we get to come back to live classes. When we had live classes, we had live presentations. But now we do videos, which we have found to be more efficient. So once you have presented and you graduate from nurse residency, you're now an RN1. You can move on to an RN2 by taking that project, everybody that's on your team, and moving it into implementation. So you can go up to an RN2 shortly after graduating nurse residency by implementing your project. And it doesn't have to be everybody on your team. Maybe only 2 people want to implement it, they can move forward with it. So whoever wants to implement it, then they can be part of it. We're going to talk about shared governance and what is shared governance and how you get it going, how you get your project going. I think I have to do this.
Shared governance? No, wait, what? I mean, we touched on it in school. We touched on it when you start as a new nurse at St. Luke's. But no, not until I had to completely Google the definition. We know that it helps allow nurses to be a part of decisions on their unit and their department and ultimately for patient safety and care. Shared governance to me means that we have a big part of our patient care and everything that we do during our shifts and our workplace, and collaborating with other departments to make a difference for ourselves and for our patients.
I did not. It wasn't something that we really went into detail about in nursing school. They touched base on it, but then throughout the process of the new grad residency, it was really explained to us, and it's just important to know what's going on throughout the system in different areas.
I heard a little bit about it. I have friends that worked at St. Luke's before I came here, and the best way that I can describe it would be it's just kind of our opportunity to have a voice in the care that we give. I would definitely say that nurses are on the front lines of patient care, and we spend a lot of time with our patients making sure they're comfortable, making sure they're having a good experience with us. And it's just a way for us to make sure that our practice is being heard, and any suggestions that we think could make patient care better and make their experience better, then we can pass that on to the individuals that we need to.
So shared governance, we actually have a process model that we can use of how do we make decisions at our entity, so at our location. So first of all, if you want to make a change in your practice, you want to go to your practice council. So being the emergency department educator, then I would attend or you would attend if you're part of the emergency department, the practice council, and you'd present what the problem is, what you found in the literature, and what you recommend as changes, and they could discuss it and find out if they want to go further. If they say, hey, I do think this is something that needs to be changed, they're going to take it up to system coordinating council, and they're going to discuss it, so at a higher level than we have. And then we have the process. Do you have anything you want to add to this, Caryl?
No, you're doing great.
Okay, so you may or may not have the system council go back and have feedback that they want to say, what about this, or what about this? So they might have to discuss it more than one time, and that's why there's arrows in different directions. But some of the changes might be, is it a financial resource that we need to use? If it is, then we have to get that approved. So there's different steps. So if it's not, then it could be approved through just the different departments voting on it. But if there is, then we might have to go into and how we're going to implement it with the financial changes. So this is a process that I'd be glad to share with you about how the change happens.
But most of the time, what I've seen with System Coordinating Council is that they'll send it to that specific level of care council. So if the problem is around in critical care, then they'll send it to the critical care council for review.
So the Emergency Department Aggression Rating Tool, the EDAR, is now system-wide. It's in all of the St. Luke's Health System emergency departments. What we're real hopeful for is after we've seen de-escalated patients, improved charting on those type of aggressive patients, that it will be coming to a department near you soon. Hopefully Med-Surg will be able to find ease with documenting on some of their more aggressive patients, as well as mother-baby. We're really excited that it's going system-wide. Nurse residency program rocks.
EDAR was actually published in the Journal of Emergency Nursing. That's their official monthly magazine. So it was published. Since it was published, we've had a lot of people from other hospitals reach out to us. They want to use the exact same tool. So it's in the process of being validated, and it probably will be used in other locations. We are using it in different departments at St. Luke's as well. Here's a picture of what the article looked like. So you could possibly take your project all the way up to become a research project, do your own research, and get published. It'd be awesome if you did that. So if you have any questions, ask your clinical education specialist during your small groups. Looking forward to seeing your projects.